5 health checkups you should avoid after 70 that may harm you more than help. There's a hidden truth that most seniors will never hear from their doctors. Every year, millions of seniors line up for health checkups thinking they're staying safe. But what if I told you that some of those tests, the routine ones your doctor says you need, could actually push you closer to surgery, stroke, or even cancer? New studies reveal that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. And shockingly, 99% of people over 70 have no idea they're being over-tested. One of these checkups, the number one on our list, actually causes 5% of all cancer cases in the US, which is equal to the number of cases caused by drinking alcohol every day. You won't hear this from your clinic. You won't see it on a billboard. But the truth is buried in the science. And today, we're uncovering it all. In this video, the 5 health checkups you should avoid after 70 and the terrifying truth about what they can do to your body. All backed by real science. And you won't believe what made it to number 2. Before we begin, let us know in the comments below where you're watching from, your age. And have you ever regretted a test or procedure? Do you think seniors are tested too much? We're reading and replying to every single comment with personalized tips and advice. And don't forget to like this video and subscribe to our channel for more videos like this. Now, without any further ado, let's talk about the first test, why it looks harmless, but could quietly ruin your quality of life. Number 5, annual chest x-rays for lung screening. It sounds reasonable, doesn't it? A quick chest x-ray once a year to check your lungs, especially if you're a former smoker or have a history of respiratory issues. No pain, takes just a few minutes, and you're told it could save your life by catching lung cancer early. But here's what they don't tell you. For most people over 70, annual chest x-rays provide almost no benefit and can lead to a dangerous cycle of false positives, anxiety, and invasive follow-up procedures. Chest x-rays are notoriously poor at detecting early-stage lung cancer. They can only spot tumors once they're already quite large, usually over 1 centimeter. By that point, the cancer has often already spread. A 2018 study published in the Journal of Thoracic Oncology found that chest x-rays failed to detect lung cancer in 60% of cases where tumors were present but still small. Even worse, these x-rays frequently show harmless abnormalities. Things like old scars from pneumonia decades ago, harmless calcifications, or benign nodules that naturally occur with age. But once they're spotted, the medical machine kicks into gear. You're sent for CT scans, which expose you to significantly more radiation. Then, maybe a biopsy, which carries risks of bleeding, infection, and collapsed lung. Let me tell you about Patricia, a 72-year-old retired librarian who went for her annual physical. Her doctor ordered a routine chest x-ray because she'd smoked in her 20s, though she quit over 40 years ago. The x-ray showed a small spot. She was immediately referred to a pulmonologist. A CT scan was ordered, showing what looked like a suspicious nodule. 3 months of anxiety followed, then a needle biopsy that punctured her lung, causing a partial collapse. She spent 4 days in the hospital. The final diagnosis? A harmless granuloma, likely from a childhood infection. The irony is devastating. Patricia went in healthy and came out with trauma, medical bills, and lung damage, all from a screening test that was supposed to protect her. The U.S. Preventive Services Task Force is clear on this. Routine chest x-rays for lung cancer screening are not recommended. If lung screening is truly needed for high-risk individuals, a low-dose CT scan is the only proven method. But even that should only be done after careful discussion of risks and benefits. For most seniors over 70, especially those who quit smoking decades ago or never smoked heavily, the risks of routine chest x-rays far outweigh any potential benefit. Better strategies include staying physically active, avoiding secondhand smoke, and watching for actual symptoms like persistent cough, unexplained weight loss, or coughing up blood. But there's something even more common that could be draining your body of essential nutrients. Let's talk about that next. Number 4, annual fasting blood sugar tests without symptoms. Testing blood sugar levels has become almost automatic at annual checkups. You're told to fast for 12 hours, show up tired and hungry, and get your blood drawn to check for diabetes or prediabetes. It seems logical. Diabetes is dangerous. So catching it early must be good, right? Not so fast. For many seniors over 70 who have no symptoms, annual fasting blood sugar tests can lead to overdiagnosis and overtreatment, causing more problems than they solve. Here's the issue. Blood sugar naturally becomes less stable as we age. Fasting glucose levels tend to rise slightly, even in healthy older adults. This doesn't necessarily mean diabetes. It's just aging. But when a 72-year-old's fasting glucose hits 110 milligrams deciliter, just slightly above the normal cutoff of 100, many doctors immediately diagnose prediabetes and start pushing medication or aggressive dietary restrictions. A 2020 study in JAMA Internal Medicine followed over 4,000 adults aged 70 and older with slightly elevated blood sugar. They found that treating mild prediabetes in this age group with medication provided no survival benefit and actually increased the risk of dangerous low blood sugar episodes, which can cause falls, confusion, and even heart attacks. The medications themselves, particularly sulfonylureas and insulin, carry serious risks for older adults. Hypoglycemia, or dangerously low blood sugar, is far more immediately life-threatening than mild elevation. Seniors who experience hypoglycemia are at much higher risk of falls, fractures, and cognitive decline. Consider Harold, a 76-year-old retired accountant who loved his morning walks and was in excellent health. At his annual checkup, his fasting glucose was 108 milligrams per deciliter. His doctor diagnosed prediabetes and started him on metformin. Within weeks, Harold developed severe diarrhea, nausea, and fatigue. He stopped his walks. His quality of life plummeted. When he came to see us, we reviewed his case. His hemoglobin A1C, which measures average blood sugar over 3 months, was completely normal at 5.6%. We stopped the medication. Within a month, he was back to his walks, his energy returned, and his glucose remained stable with simple dietary adjustments like reducing refined carbs and eating more vegetables. The truth is, unless you're experiencing symptoms of diabetes like excessive thirst, frequent urination, unexplained weight loss, or blurry vision, annual fasting glucose tests after 70 may not be necessary. A better approach is checking hemoglobin A1C every 2 to 3 years, which gives a more complete picture without the volatility of a single fasting test. And if you do have mildly elevated numbers, lifestyle changes, not medications, should be the first line of defense. Regular walking, strength training, and a Mediterranean-style diet have been shown to reduce diabetes risk by over 50% without any of the side effects of medication. Now, let's move to a test that's been sold to women for decades as essential, but after 70, it might be doing far more harm than good. Number 3, routine mammograms. This one is controversial, but the science is clear. Routine mammograms, which are X-ray screenings of the breast tissue to detect cancer, become increasingly problematic after age 70, especially for women with no family history or symptoms. The medical establishment has been promoting annual mammograms for so long that questioning them feels almost heretical. But the data tells a different story. After 70, the rate of false positives skyrockets. These are results that suggest cancer when there is none, leading to biopsies, lumpectomies, and even mastectomies for cancers that would never have caused harm in a woman's remaining lifetime. This concept is called overdiagnosis, and it's shockingly common. A 2016 study in the Annals of Internal Medicine found that up to 31% of breast cancers detected by mammography in women over 70 are overdiagnosed. That means nearly 1 in 3 women are diagnosed and treated for cancers that would never have threatened their lives. The treatments themselves cause real harm. Radiation therapy can damage the heart and lungs. Chemotherapy devastates the immune system, especially in older adults. Surgery carries risks of infection, anesthesia complications, and prolonged recovery. And here's the kicker. Routine mammograms after 75 show no mortality benefit whatsoever. The U.S. Preventive Services Task Force states there's insufficient evidence to recommend routine screening after 74, yet millions of women continue to get them every year simply because that's what we've always done. Take Eleanor, a vibrant 78-year-old artist who still taught painting classes twice a week. She went for her annual mammogram, which showed a suspicious area. A biopsy confirmed ductal carcinoma in situ, or DCIS, which is a very early stage, slow-growing abnormality that many experts don't even consider true cancer. She was terrified. She underwent a lumpectomy and 6 weeks of radiation therapy. The side effects were brutal. Extreme fatigue, skin burns, and anxiety that robbed her of the joy she once found in painting. 2 years later, she told us she wished she'd never had that mammogram. The cancer they found was so slow growing that it likely would never have affected her in her lifetime. This doesn't mean ignoring breast health. If you notice a lump, nipple discharge, skin changes, or pain, absolutely get it checked. But routine screening mammograms after 70, especially after 75, often create more problems than they solve. A more sensible approach is having an honest conversation with your doctor about your overall health, life expectancy, and whether finding early-stage cancer would truly benefit you or simply lead to treatments that diminish your quality of life. But now, we come to a test that's even more commonly pushed on seniors, often with devastating results. Number 2, prostate-specific antigen PSA test for prostate cancer. For men over 70, the PSA test has become almost ritualistic. A simple blood test that measures levels of prostate-specific antigen, a protein produced by the prostate gland. Elevated levels might suggest prostate cancer, so it seems smart to check regularly. But here's the harsh reality. PSA testing after 70 causes far more harm than benefit, and major medical organizations, including the U.S. Preventive Services Task Force, recommend against routine screening in men over 70. Why? Because most prostate cancers in older men grow so slowly that they'll never cause symptoms or shorten life. In fact, autopsy studies show that up to 80% of men in their 80s have prostate cancer that never caused any problems. They died with prostate cancer, not from it. The PSA test can't distinguish between aggressive cancers and slow-growing ones. When it comes back elevated, which happens frequently due to benign conditions like prostate enlargement or infection, a cascade of invasive procedures follows. Biopsies, which involve inserting needles through the rectum into the prostate, carry risks of infection, bleeding, and sepsis. Then comes treatment, surgery, radiation, or hormone therapy, all with severe side effects. The side effects of prostate cancer treatment are life-altering. Urinary incontinence affects up to 50% of men after surgery. Erectile dysfunction occurs in 60 to 90% of cases. Bowel problems from radiation can be chronic and debilitating. And for what? A 2017 study in the New England Journal of Medicine followed over 76,000 men for 13 years and found that PSA screening did not reduce deaths from prostate cancer. Let me tell you about Robert, a 74-year-old grandfather who loved fishing and spending time with his grandchildren. His PSA came back slightly elevated at 5.2 nanograms per milliliter. His doctor ordered a biopsy. 12 needles were inserted into his prostate. The results showed low-grade cancer, Gleason score 6, which many experts believe shouldn't even be called cancer because it rarely progresses. But Robert was scared. He opted for surgery. The operation went well, but the aftermath was devastating. He developed severe incontinence, wearing pads every day. He became depressed, stopped fishing, and withdrew from his family. When we reviewed his case, we realized that with active surveillance, doing nothing but monitoring, he likely would have lived the rest of his life without ever needing treatment. The American Urological Association and the American Cancer Society now recommend that men over 70 with a life expectancy of less than 10 to 15 years should not undergo routine PSA screening. The risks simply outweigh the benefits. If you're a man over 70, unless you have clear symptoms like difficulty urinating, blood in urine, or bone pain, skip the PSA test. Your quality of life is far more valuable than a number on a lab report. And now, we've reached the most dangerous, most overused, and most harmful screening test for seniors over 70. Number 1, full-body CT scans. Full-body CT scans are the ultimate example of too much medicine. Often marketed as executive health screenings or preventive full-body scans, these tests promise to catch cancer and disease early. They're expensive, often costing thousands of dollars, and they're completely unnecessary for healthy seniors with no symptoms. Here's why they're so dangerous. CT scans expose your body to massive amounts of ionizing radiation. A single full-body CT scan delivers 10 to 20 millisieverts of radiation, equivalent to about 500 chest X-rays. According to research published in JAMA Internal Medicine, the dramatic rise in CT scans over the past 2 decades may now be responsible for up to 5% of all cancers in the United States. That's right. The test meant to find cancer is actually causing it. For seniors over 70, whose cells are more vulnerable to radiation damage and whose bodies are less capable of repairing DNA damage, this risk is even higher. And what's worse, there is zero evidence that full-body CT scans in asymptomatic people save lives. None. The American College of Radiology strongly discourages their use. What these scans do exceptionally well is find incidental findings, meaning harmless abnormalities that would never cause problems. A tiny lung nodule, a benign kidney cyst, a small liver lesion. Suddenly, you're thrown into the medical system. More scans, biopsies, surgery, complications, and in the end, it was all for something that never would have hurt you. This is exactly what happened to Linda, an 81-year-old woman who felt great and was still volunteering at her local library. She decided to get a full-body CT scan as a birthday gift from her children, who wanted to ensure she stayed healthy. The scan found a 4-millimeter nodule in her lung. She was sent to a pulmonologist, then scheduled for follow-up CT scans every 3 months, exposing her to even more radiation. After a year of anxiety and scans, a biopsy was performed. The nodule turned out to be scar tissue from a pneumonia she'd had 20 years earlier. But the biopsy caused a pneumothorax, a collapsed lung, and she spent a week in the hospital recovering. She told us later that she wished she'd never had that scan. She was perfectly healthy before it, and now she was traumatized. The truth is simple. If you have no symptoms, you don't need a full-body CT scan. If you have symptoms like unexplained weight loss, persistent pain, coughing up blood, or visible lumps, then targeted imaging makes sense. But scanning your entire body just to be safe is like playing Russian roulette with radiation. Major medical organizations worldwide, including the FDA and the American College of Physicians, Advise against full-body CT screening in asymptomatic individuals. The potential for harm far exceeds any possible benefit. If you want true prevention, focus on what actually works. Regular exercise, a nutrient-dense diet rich in vegetables and lean proteins, quality sleep, stress management, and maintaining strong social connections. These lifestyle factors have been proven to prevent disease and extend healthy lifespan far more effectively than any scan ever could. So, there you have it. 5 health checkups that seem helpful but can actually cause serious harm, especially after age 70. Modern medicine has incredible tools, but more testing is not always better. Sometimes the smartest choice is to do less, not more. The key is to be an informed patient. Always ask your doctor these critical questions. What are we looking for with this test? What happens if we find something? What are the risks of the test itself? What are the risks of not doing the test? Is there evidence that this test improves outcomes for people my age? If the answers aren't clear, or if the risks outweigh the benefits, it's okay to say no. Your body is not a machine that needs constant scanning and prodding. Trust your instincts, listen to your symptoms, and focus on living well, not just living longer. Real prevention doesn't come from a lab or an imaging center. It comes from how you move, what you eat, how you sleep, and who you love. Stay active, eat real food, keep your mind sharp, nurture relationships. These are the things that truly matter. Now, we want to hear from you. Have you or someone you love ever faced complications from a medical test or treatment that turned out to be unnecessary? What happened? Do you think seniors are being over-tested? Share your experiences and opinions in the comments below. We read every single one and reply with personalized advice. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more evidence-based health information designed specifically for seniors. Hit that notification bell so you never miss a video. Thank you for watching, and remember, you have the right to choose what happens to your body. Choose wisely.